The White House says President Biden will end the COVID-19 public health emergency this spring.
The move comes as most of the world returns to normalcy. WGN's Shannon Halligan here with more on what that really means.
Yeah, the Biden administration considered ending the emergency last year, but held off. That was partly to allow providers, insurers, and patients time to prepare for the end of these pandemic protections. Officials warned an immediate end would sow confusion and chaos in the critical wind down.
Thank you very much, everyone.
It's been nearly 3 years since then President Donald Trump first declared the COVID-19 pandemic a national emergency.
To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency.
That was March of 2020. Since President Joe Biden took office, the national and public health emergency declarations were extended. Now the president plans to extend them both briefly to end on May 11th. This comes following resolutions being brought to the House floor by Republicans to bring the emergency to an immediate end. House Republicans are also gearing up to launch investigations on the federal government's response to COVID-19. It was in February of 2020 that the World Health Organization revealed the new name for the virus.
We now have a name for the disease, and it is COVID-19, and I will spell it. COVID-19. CO stands for corona, as you know. VI stands for virus, D for disease, so COVID.
Since then, more than 1.1 million people in the U.S. have died from the virus. That's according to the Centers for Disease Control and Prevention. Now, with the end of COVID-19 emergencies, there will be big changes in the healthcare system. Lawmakers have already started the drawdown of most federal COVID-19 relief money. The development of vaccines and treatments will be shifted away from the direct management of the government. The cost of COVID-19 vaccines are expected to skyrocket. Pfizer said it will charge as much as $130 per dose. Free at-home COVID tests will also come to an end. Hospitals will not get extra payments for treating COVID patients, and millions of Americans could lose Medicaid by April as a pandemic rule that barred states from kicking people off Medicaid comes to an end. And for those millions who lose Medicaid coverage, the Department of Health and Human Services announced a special enrollment period for Obamacare. Those people can apply outside of the normal enrollment period. That's if they live in a state that is served by the federal marketplace.
Thank you, Shannon.